my name is Jordan Harding, and I will be showing you the goniometer measurement for hip abduction. To start, we want our individual positioned in a supine position on the table, knees fully extended. And we'll first talk about the points of the goniometer that we're going to be looking for, the landmarks on our individual's body that we want to place the goniometer on. First, for the axis, we're going to be working with the ASIS of the hip on the measurement leg for the axis. For the stationary arm, we're going to have an imaginary line leading over to the opposite ASIS, and that's where we'll position our stationary arm. Our movement arm is going to travel down the midline of the femur and bisect that. And I like to normally just lay our goniometer there just on her stomach. That way it's already in position for us to grab. And when we're moving them into hip abduction, we want to be aware that we're not rotating internally or externally the leg. We also want to make sure we're not flexed. So we want to just make sure we have a neutral hip position. So with one arm, I'm going to grab the lower part of her leg. You can look or you can feel, but you want to be aware of the opposite ASIS. So as we move out into hip abduction, again, maintaining a neutral hip, we want to look, see, and feel for that opposite ASIS to compensate or move. So, again, just kind of watching it, playing with it. And I feel it about right there. Go ahead and relax for a sec. And I'm going to drop her leg. Hold that there. Finding our landmarks at the ASIS. Again, bisecting that femur down towards the patella. And for her, I am reading 45 degrees. We'll do the other side. Drop it right there. Hold there. There, a little bit of a difference. So we have 33 degrees there. And if I remember correctly, were one of your hips feeling a little tighter?
Yeah.
Which side was that?
I think right.
So optimally we want 45 degrees of hip abduction on her left leg. She was right at 45 degrees, but her right leg, she was at 33 degrees. And she has been complaining of, a tight right groin as she's been running these past few days. So just again, a little bit of history, and then through the assessment, we have seen that there is a little bit of hip abduction tightness.